Hello, everyone. We're going to get started. My name is Juliet Palin, Community Engagement
Welcome to
Supervisor from the Department of Public Health
Juliette
Preparedness
Palin.
Program.
Moi, c'est un
Along with
superviseur
me
pour
presenting
engagement de
is
communauté du
Shawnee
département de
Andrews.
public health
She is our health educator,
en préparation.
and our program will
Ensemble avec
help
mon English
communities
Shawnee
prepare
Andrews,
for
je suis
public health
éducateur santé
emergencies.
et programme
Today, we'll be talking
sécuritaire
about summer in the city
d'urgence santé
2024,
publique. Je
staying
viens de vous parler
healthy
par
and
rapport
safe
de
during very hot
l'été dans la
weather.
ville là dans 2024 pour être sain et sauf et aussi pour être en bonne santé pendant que le
Before we
marche
get
pas.
started,
Avant que nous
just
commencer,
wanted to let you all know that
et
this
nous connaissons
session
que
is being
session
offered in a
ça,
number
nous-mêmes
of
nous offrons
different
dans
languages.
différentes qualités de
To
langue.
participate in the
Pour
session in
participer dans la
another
session
language,
dans l'autre langue,
press the globe icon
c'est
on the bottom of your
icône
screen and then choose which language you would like
mode
to
là en bas
use.
écran et puis justement choisir qui langue que nous allons utiliser.
Thank you to our
Merci à
interpreters.
tous les interprètes nous.
We have American Sign Language,
Langue de
Arabic,
l'américain,
Malay,
arabique,
Vietnamese,
mandarin,
Spanish, and
vietnamite,
Haitian
espagnol
Creole.
avec le haïtien.
Also, this session will
Et
be
aussi, pour
recorded
session
and
ça, nous
uploaded
avons
to
enregistré
YouTube,
les
so
nous-mêmes
anyone who couldn't attend can
n'importe
still
monde
get
qui
the information.
peut participer, mais on a toujours joindre l'information ça.
If you have questions throughout the session,
Question
please
pour la
type them
session,
in the
semblez
Q&A box
taper
at the
dans
bottom of your
Q&A,
screen. We'll
en bas
answer
écran là, nous
questions
allons répondre aux
at the
questions
end
à
of
la
the
fin
presentation,
de
or someone will type back the answer
session
throughout.
pour bien mon numéro 4
If you are calling in
à
and
la
your
fin,
questions
je
are
vais
not
m'aider,
answered,
puis on va
you
répondre aux
can email
questions.
us at
Nous avons email nous dans public health preparedness
publichealthpreparedness@phila.gov
à
or give us a call at
commercial.gov. Donc, les 215 429
215-429-3016.
3016.
Thanks to everyone from the health
Merci
department
tout le
here to
monde pour
answer
le département de
questions.
santé qui est là, qui peut répondre aux questions.
So let's get started.
On commence.
So the first little question I have for
La première
everyone
question
to
que moi
think
j'ai
about
pour que mon
is,
cas
what
penser
are
de
your
c'est
favorite
que
things to do in the
ça
summer?
que même aimé faire en été.
For me, it's
Pour moi,
spending time at the
passer
beach on
temps
the
dans la
weekends,
plage, dans le week-end,
or
ou
going to have a
bien
picnic at
aller dans
Kelly
le pique-nique
Drive
dans Kelly Drive
after work.
après le travail.
The summertime is a season to
Donc,
enjoy
pour
the
été,
warmer
c'est
weather,
temps pour que même
be outside longer. I see
passer
pool
temps
kids
ensemble
coming in
avec
through the chat.
été, aller dans la
Spend
piscine,
time outside longer since
passer
it's the
dehors,
sun's out later.
que le soleil la lune dehors, puis longtemps.
But we have to be careful when we
Mais
are
il faut nous faire
spending a lot of time
attention, même
outside,
si nous passons plus de
because
temps
heat
dehors, parce
exposure
que
can make you sick and it can even
exposé ensemble
deaden you.
avec
And so the first slide,
température,
or
les
next
droits
slide that I have up, excuse me,
dangereux pour santé. Et
as the
aussi,
CDC
même,
studies weather
bah,
hazards, they have
on va
found
mourir
that
de l'eau.
extreme heat has
Premier
been
temps, on dit
the cause
extrêmement
of more
sauvage,
deaths than
extrêmement,
any other weather hazard.
pour cause de pis,
On this
cause
slide, we have a
c'est
chart
pour
from
ça,
the
nous avons
National Oceanic and Atmosphere Administration. It shows heat
national,
with the highest
l'administration, les
number of
montrer que le chauffage,
fatalities
c'est
when
ça qui la
compared
cause
to
plus que
other
mon
weather
mourir, les
hazards
quand même, yo.
like
On peut
flooding,
aider avec
winter
peut-être un coup.
storms, lightning, tornadoes, and hurricanes. And for a lot of people, this can be
Non,
surprising
pas que le monde sont barricades
because we
parce que
often hear about
souvent nous
destruction
entendons qu'on parle
from
par rapport de
these other
destruction,
weather hazards like
de
flooding and
l'autre bagaille, donc
tornadoes. And so we'll talk a little
inondation,
bit
bien
about how
cyclone,
heat
que nous parlons
affects
parler par rapport de
your
qui
health a
chauffage,
little
même
bit later
affecté
on.
contingent pita.
You may have noticed that summer
Ou
seems
t'es qu'à
to have
reconnaître
gotten a
que
lot
été,
warmer
lui-même, au
than
cas où que
when
les
you were
plus
younger.
chaud avant de que les quand même où t'es
It is
jeune.
true that because of the
Oui,
climate
c'est vrai
emergency and
que
climate
bien sans
change, the
climat ou bien
city is
changement de
getting
climat,
hotter.
là, lui-même, il commence à plus
On
chaud.
this slide, we see a
Oui,
table
comme
that
ça, nous
shows
avons
heat
une table qui
projections
montre projection
from
par
Philadelphia's Office
de
of
Office
Sustainability
de
Growing
Philadelphia
Stronger
de
report.
Kote va su
The first row
rapport
shows
montre
the
sou tableau
average
sa.
summer
Premier ligne
temperature
montre
in Philadelphia,
une
and you'll
moyenne
see it
de
shows
température à Philadelphie.
84.5
Il montre
degrees Fahrenheit.
84,5
And that's historically the summer average that we see.
et ça, c'est normalement niveau que nous
As we
mettons.
look to the
Donc,
future
pendant
and
que nous
over
regardons
time,
dans le
we know
futur,
that climate
nous
change
connaissons
will
que
cause the city to
changement
get
de
hotter.
climat, lui-même la
So our
ville, lui-même,
projections for the
une
future
so
is
projection nous dans le futur,
the average summer temperature
et
to be 91 to
numéro que nous
96
adressons
degrees.
entre 91 à 96 dans le futur.
The next row shows the
L'autre,
average number of days above
l'autre colonne dans
95.
le
And
date,
historically,
dans
we
le
don't
futur,
see more than 3 days above that
3
95
jours plus que
degrees.
49 degrés. Hein.
As we look to the future and have projections, we
Si
are
que nous regardons
expected
le
to see
futur, puis nous avons
28 to
projection,
67 days
nous
above
faisons jusqu'à
95 degrees, which is a
côté
lot,
28 à
especially
67
for
jours, côté
Philadelphia.
91 degrés. Oui,
And
so c'est
then the last row is the
Philadelphie.
average number of days above 100 degrees. And typically, we don't see
Donc,
days
typiquement, nous
above
même
that
pas
100
ouais,
degrees. But
jour.
again, as we look to the future,
Après que nous même nous,
we're
quand dans
expected
le
to see
futur, nous
7
expectons
to 31 days
7,
above that
11
100-degree temperature.
jusqu'à 100 degrés.
So we're expecting hot
Donc,
summer
nous avons
days,
souhaité que
long consecutive hot days.
les
And so we want
consécutifs
to be
côté
sure
que
to
il faut
help
vraiment,
you
mais
all prepare for
il y
these
a
high
ceux que
temperatures
nous devons
that
préparer
can
parce que c'est
affect
pour ça
your
qui
health.
a affecté santé.
And a little did you know, summer of 2021, Philadelphia recorded
Été
37 days
2021, il y a
of
même
90 plus
été
degrees.
fait
So we can tell that the
enregistré
city is getting hotter.
37 jours côté que l'été chaud. So, nous avons que Villa, il y a plus chaud, il y a plus chaud.
Moving to our next slide, we will
Nous
talk about
allons parler par
the
rapport
urban heat island effect.
au burn
And
heat
so heat
island effect.
exposure is
So,
a big
exposé
concern
avec
for those of
santé,
us living in the city
on
because
a
of
vécu
the
dans
heat
villa,
urban
avec
heat island
par exemple,
effect.
ou bien ça que les urban
This
heat island.
slide shows a slightly
Et
abstracted
quand
line
ça, montre
graph
une
that
ligne
shows
qui est
the
abstraite
overall
qui
temperature
montre
rising as you
environ
go from rural to suburban
soit
to
aller
commercial
dans
to city.
rural, suburban, commercial,
This
ville.
chart shows that while
Ça lui
the
montre
city
même là
might
que dans villa,
experience
nous nous avons
temperatures you can
expérience
see
avec
in
ça,
that like 90 degree
90 degrés.
um, weather, our suburban
Sur
counterparts
la
may
fin,
only see temperatures in the
nous
80s.
avons une température dans 80.
Basically, this means that
Ce
cities
qui
are
veut dire
hotter
que
than their
ville est même
suburban
plus
areas
chaud de
because
zones
of
qui
built-in environment features
d'habillation parce
like
que l'environnement est même
buildings,
on peut changer côté building,
industrial activities,
bien
lots of
activité
roadways
industrielle,
that
qui est
absorb
dans
heat,
côté qui
cities
absorbe
in general and
chauffage, ville
parts of
en
each
général,
city
et
can also have
partie de ville,
limited vegetation
bien,
and tree
végétation
coverage.
limitée, puis
And
côté qui
those
marche.
types of plants
Qualité
are
de
things
plants, ça,
that add
même,
natural
yo
cooling
bay,
by increasing
yon,
shade
façon
and
comment on peut
decreasing the
réchauffer,
temperature.
puis réduire la température là.
And as we go to our next slide, we know that heat
Maintenant, aller
exposure
à l'écran,
also
donc,
varies widely within our own city. And so the city developed a heat vulnerability index in
développer,
2018 to summarize the most
et
important
pour
factors
à résumer, facteur
associated
qui est
with
important, qui est
adverse
associé
health
ensemble avec
impacts of extreme heat.
partenaire pour avec
And
santé.
so this data-driven approach really identified which city
Ça, il y a
neighborhoods are most at
une
risk,
activité qui
so we
implique
can
oui,
allocate some of
que
the
nous allons
limited resources like
gérer
cooling
le
centers and
temps
buses and educational
à
initiatives equitably. The index looks at
dans les
demographics
mêmes
and
regarder avec la
socioeconomics, health
démographique,
status,
avec
and environmental
statut
exposures, and all that
démographique,
data is combined to
socio-économique, avec
form
statut
the
de
heat
santé,
vulnerability
de
index.
environnement, so, ça, les mêmes informations, ça, les permettre que
And
nous
on our screen now, you
et
can see
donc, on y a sur l'écran,
a
nous, pour
screenshot
savoir
of
combien
our index map.
côté que
And
yo
so this
fait
map
un screenshot
shows an
côté que map ça
analysis
lui-même li
of
ka montre une analyse
surface
de
temperatures by census
température
log.
surface
This
par
map, as you can see, shows
map ça
the
lui-même li
neighborhoods in
montre
Philly,
zone dans Philly,
and it indicates the hottest
Philadelphie qui indique
boxes
tant
or the
qui
hottest
plus chaud,
neighborhoods in red.
les zones qui plus chaud en
That
rouge,
can be 22 degrees
Ak gen doit
hotter than those cooler
22
lots that
degrés
are in
plus que
yellow.
l'autre boîte qui en
Some of
jaune.
these high heat
Gen
vulnerability
ket ba chauffage
neighborhoods
sa nan
are
zon nan
Cobbs
ki
Creek, Overbrook,
Hobbs Creek,
Point Breeze,
Overbrook,
Strawberry
Breeze,
Mansion,
Strawberry
Barchamp,
Mansion,
and Hunting Park.
Barchamp avec Hunting Park.
Some of those neighborhoods that I
Nan zon
mentioned
sa mwen sot
have a lot
mensyone
of
yo.
exposed
Gen yon paket,
asphalt, not a lot of trees
yon
or
pou
green
asfalt,
spaces.
te ya, pa gen oken kote ki
And
pa
you
gen
can
oken
notice
pas
some
ki
of the
gen te
older
bois.
homes
So ka
have
remake nan, cham
black
ki pi
or
ansen
dark
yo, menm yo
roof,
genyen,
and that roof
dokay ki noir,
absorbs heat, making it
epi
hotter in
dokay
the
sa li an
winter.
li fe ke zon nan li men li pi chou, el vin fel pi chou.
And I just want to highlight you can visit the bit.ly
Mwen vle si ve
slash
ka,
PHL heat
ale,
index to
Bitly
search
Heat
your
Index pou ke
neighborhood
mwen
on the
ka
map.
gade
I'm going to
pou zon
slide
kote
it over
kete, pou ka
quickly.
gade nan zon nan.
This is what the map looks like, and you can type
Se kon
your
sa map la
address
li ressemble, so
at
pa
the top
tape
here
adres pou an
and
ou
see
an.
where your neighborhood lies on the
Pou wè
heat
ki kote ki
vulnerability
zon nou an li
index.
men liye nan
You can also find the
ajan ye ou.
closest cooling center,
Ki
spray
kote ki yo ka
ground,
chofe,
pool,
ki yo,
and senior
te
centers.
ki yo men yo gen kote yo spray glow, kote ko ka rechofe
So we
ou.
hope you utilize this map to see
Yo souwete ki yo men
where
utilize
your
map sa
neighborhood
pou wè
lies.
kote ke zon koto rete a li men liye.
This next slide is two pictures
An
of
lot ekran se
neighborhoods
te
in
foto
Philadelphia.
de zon nan
The first
Philadelphie.
picture at the
Premye
top
foto a an
shows
ou
a
a.
very sunny
Ki
day
montre
in North
yon kote
Philadelphia
ke
with
nanjou nan Philadelphie.
lots of cars on the street,
De kon paket
not
machin
too
la
many
riyan.
trees.
Pa telman pieboa.
In the next picture below,
Lot
you
foto an
see a
ba.
neighborhood
Kawe
also
yon
sunny
zon. Kote ke gen
in
soley.
Center City
Nan
that
Center City.
has lots of trees
Yon paket
providing that natural
pieboa. Ki
cool
bay.
and shade,
Kote ke
and
ki
then
kouvri.
only cars on one side of the street.
E pi
And
yon
so
sol
these
machin
two pictures
nan
just show
la riyan. So foto sa.
how our
Yon
city
foto
can
montre ki
differ
jan ke
depending on the
yon nan li men
presence
li
of
ka
trees
diferan.
and
Dek
cars,
yon pa apor
and
de
knowing that there are
presence
multiple
de
ways that
pieboa.
the
Konen ke yon
city can
paket
be
diferan fason
hotter
ke di la li
just
men
by
li
the
kapab.
absence or presence of
Show
trees.
que ce soit absent ou bien présence de.
And so before we go to
So,
the next
avant que
slide,
nous
I'm
même
going to
parler
stop
dans
to
l'autre
make sure
écran,
there are no
n'a
questions
pas
in the
phone pour
chat.
m'assurer que pas de aucune question dans le chat là.
Doesn't look like it. So I'm going to pass it over to
Je vais
Shawnee,
passer
who's going
par
to talk about
Shani, je vais parler
understanding the signs
pour
and symptoms of
comprendre
heat-related
avec
illness.
symptômes de
So as temperatures rises, it's important to recognize the signs and
important
symptoms
pour
of
qu'on connaisse les
heat-related
symptômes
illnesses.
de
By
chauffage.
understanding these symptoms, we
Là,
can take
comment on
proper
comprend les
steps
symptômes
before we
ça,
can treat
pas
the
prendre étape
condition.
qui est appropriée pour que mon cas préventer conditions
So
ça.
heat rash, also known as
So,
prickly heat, is
côté
a
que vous
skin
gagnez
rash
gâté le
caused
chauffage,
by trapped sweat
ça
beneath
lui-même
the
lui fait
skin.
que souhait qui était en bas,
Symptoms are typically red clusters of
symptômes
small
non,
blisters that look like
par
pimples
égaux. Donc,
on
il
the
semblait que
skin,
c'est pourtant curieux,
usually around like the neck,
sont environ
chest,
dans quoi,
arm, or
poitrine,
in the elbow creases.
dans
It
l'aine,
occurs when you, if this occurs, you
augmenté,
want to stay cool,
car ça
stay
arrive,
dry
pour
fit,
t'arrêter,
keep the rash dry,
pas
and use
chauffer,
water to smooth the rash.
utiliser poudre pour qu'on puisse mettre les sous gâtel là.
Next is sunburn. So we all
Notre
have
là,
experienced
c'est
with
côté
sunburn.
que
If we
corps
haven't, we
brûlé,
probably know people who've experienced sunburn.
mon
This occurs when
expérience
your
dans
skin is
brûlé,
exposed to
peut-être
too
corps
much
exposé
sunlight.
avec trop
It causes
soleil,
the skin to become
il fait que le
painful,
soleil là vient
red, and warm to
pas
the
mal,
touch.
et puis,
Sunburn draws
et puis, il
fluid
a
to the
brûlé
skin's
point.
surface and away from the rest of the body,
Et sur
which
souffle,
can lead
bien
to
sous,
severe
ce côté dans le
dehydration
pouvoir,
if
et
the
puis, ça lui
suntan
a fait
is severe.
déshydrater, c'est que les sévères,
If you experience sunburn, stay out of the sun. It's important until your
c'est
sunburn
que
heals.
brûlé.
Nó làm cho
Hasta
cái
que
da
haya
trở nên rất
sanado.
là đau đớn, đỏ vào
Sorry about that. If you experience, if you experience sunburn, stay out of the sun. It's important until your sunburn heals. Use cool cloths or sunburn on the sunburn area, or take a cool bath. So apply some moisturizing lotion to the sunburn area. Do not break any blisters, as this can cause further infection. So how can we
Ça
prevent
ka la cause
sunburn?
plus d'infection.
We want to wear
Déjà, comment on peut
sunscreen
empêcher
like
ça? Vous pouvez mettre
SPF 50 or higher.
crème pour protéger
Apply
quoi
30
contre le
minutes
soleil, ou
before
appliquer les
outside.
30
Be
minutes
clear
avant
about
pour aller
what is
dehors,
listed on packaging.
puis réappliquer les,
You also want to
puis les
wear
montrer sous ça.
sunglasses and a wide brim
Vous les mettez
hat to
lunettes
protect yourself
et puis vous
from
les mettez en
sun.
chapeau qui va protéger de soleil là.
Now, we've all experienced some type of
On
muscle
fait
cramp, in our
expérience
time.
camp
But in relation to the heat, it
en
is
relation ça
usually
avec
first sign
chauffage,
of
c'est
heat-related
premier
illness.
les
You
maladies.
may experience heavy sweating during intense exercise, muscle pains, or even spasms.
Donc, on
If
fait
this occurs
côté
and you
corps,
are
les
doing
mêmes les
physical
problèmes.
activity,
Si que moi
stop
fait
the activity, move to a
activité, si
cooler
tu dois faire
location,
activité, aller dans
rest, and
qui
hydrate.
cool, reposer, et puis
It's
il
important to seek medical
est vraiment
attention
temps pour que mon
if
cas
the
sache,
current lasts
attention
more than an
médicale, si
hour,
que moi campier
or
même
if you or someone
temps. Bien sûr, même, ou bien
has
si que gagnons,
heart
moun yo même
problems
un
or
problème,
on
que
a low sodium diet.
bien yo sur un régime
Muscle
qui,
cramps can
dans tout
indicate
cas,
something more
sodium.
severe, like heat
Comme
stroke,
dans musclan, li gen doit montrer un
exhaustion.
bagay qui plus sévère, stroke, chauffage, ou bien un bagay qui plus sévère.
Heat exhaustion happens when your body
C'est que exhausté à cause de
and is having a
chauffage,
hard
côté
time
quoi,
cooling
les mêmes les
itself down.
chauffer, puis li
It
va
can develop after a few
réduire.
days of being in very hot temperatures or
Li ka
not
fait
even
là,
having
tout ça.
enough fluids to
Côté
drink.
qu'on va même
For
gagner assez de
example,
l'eau pour
you're
boire, soit par
sweating a
exemple, ou
lot
après,
and not taking in enough fluid.
et puis, ou
Symptoms
pas
include heavy
utiliser
sweating,
l'eau, côté qu'on casse un
cold,
peu,
pale, and clammy skin,
côté ouais,
nausea or
pour
vomiting,
pâle,
muscle cramps,
et pour problème
tightness or
de
weakness,
muscle,
dizziness,
tête virée,
headaches,
tête fait mal,
fainting,
tête
sometimes passing out.
indisposée.
If these symptoms occur
Les
to you or
symptômes ça, les
someone
mêmes
that you
arrivés, en tant
know,
que monde que
rest in a
connaît,
cool place,
reposer non côté
mostly
qui
air
cool,
conditioned space. If you don't have
non côté qui
AC,
est conditionné, si
rest in
qu'on
a
pas
shaded area.
conditionné, cherchons
Sip
côté
cool,
qui
non-alcoholic beverages.
pas gagné.
Take a cool shower or bath.
Bien,
If you don't have access to these things, use a cool cloth or a wet paper towel. You can even use a t-shirt and place it behind your neck, under your armpit, or in the groin area to help cool the body down. If symptoms worsen or last longer than an hour, you should seek medical attention immediately. It could be something more detrimental, like heat stroke. So heat stroke is one of the most serious health heat-related illnesses. It occurs when the body becomes unable to control its temperature. The body temperature rises rapidly, the sweating mechanisms fail, and the body is unable to cool down naturally. It can cause death or permanent disability if emergency treatment is not received immediately. Some symptoms of heat stroke are high body temperatures. So this could be 103 Fahrenheit or higher, hot, red, dry, and damp skin, fast, strong pulse, headaches, dizziness, nausea, confusion, or loss of consciousness. If you think someone may be experiencing any of these symptoms, it's important to call 911 right away and then move that person to a cooler space. While waiting for 911, try and cool them down with cool cloths, pour water on them, cool them down by any means possible to get the body temperature down. As we approach the warmer weather, it's important to know what to do if someone seems sick from the heat. What we want to do is help them cool off. Get help and call 911 if you think it's an emergency. And it's okay if you don't know what type of heat illness they have, whether it's heat stroke or exhaustion. It's best to help them stay cool and call 911. Also try to get them help early before their condition worsens. Extreme heat events can increase risk of dehydration, heat exhaustion, and heat stroke for all people, but particularly for the older Philadelphians, children, and other sensitive populations, as you see listed on the slide above. We will use this slide to see who is at greatest risk of heat illnesses. So when looking at risk factors, we look at exposures, social factors, and biological factors. We want to especially highlight those without ACs, people who are homebound, people who are living alone, and older adults. These people never had a break from the heat. We want to make sure those warmer days in this summer, we are checking on our family and friends who may be at most at risk. We want to prevent anyone from getting sick from the heat. So we'll be going over important tips to prevent heat-related illnesses. So drinking plenty of water throughout the day, such as drinking plenty of fluids out the day, such as water, sports drinks, or fruit juice, even if you don't feel thirsty. Plan your day so you don't spend too much time in the sun or heat. Avoid strenuous activities outside between the hours of 11 a.m. and 4 p.m. when these are the hottest part of the day. Don't wait for an emergency. Don't wait for an emergency if you start to feel overheated. Go indoors or find a cool space immediately. You want to prepare your home for hot days with utility assistance, AC, fans, curtains, and supplies to stay cool. So later in our presentation, we'll talk about utility resources as well. And if you live alone, make sure someone knows to check on you. Or if you know someone who lives alone, make sure that you're checking on them as well during those hot days. So I'm going to stop here and see if we have any questions in the chat. Yeah. So next we'll talk about heat and chronic health conditions. Excessive heat can worsen pre-existing health conditions. These include diabetes, heart disease, kidney disease, respiratory disease, and mental health conditions. Some medications like beta blockers and diuretics, such as water pills, can also affect how your body responds to the heat. If you have any of these conditions or take any of these medications, it's important to talk to your doctor to learn how to reduce your risk of heat-related illnesses. So for those who spend a lot of time in their homes, we have some home heat safety tips to keep you safe and healthy. So once you use a fan, open a window and use a fan when it's cooler outside than it is indoors to bring cooler air in. If it's 90 degrees or hotter inside your house and it's also hot outside with little to no breeze, it's best not to use a fan because it will circulate the hot air, which can cause no relief from the heat. If you have a multi-level home, spend most of your time on the lower levels, which are typically cooler. You want to close windows and curtains along with your blinds during the hottest part of the day, which is typically 11 a.m. to 4 p.m. And we want to avoid using ovens or stoves during the hot weather, which can heat the home. We have several materials that we will share later in the presentation to help you remember these tips.
Thanks, Shawnee. So now that you've learned about heat in the city and recognizing the signs of heat-related illnesses, You might be asking yourself, what can you do next? First thing you can do is stay informed. And so pay attention to the local weather conditions and know when the weather might be harmful to your health. Multiple days of those high temperatures are the most dangerous. And you also want to know what to do if you see those signs of heat-related illnesses. Next thing you can do is stay cool. If you can, encourage your neighbors, your family members, your friends to avoid direct sunlight and limit your time outside. Shani mentioned that 11 to 4 p.m. is the hottest time of day. So if you can find time to go outside, not during that time, it's the best way to stay safe and healthy, especially on those warm days. And then the last thing, you can stay hydrated. Drink plenty of water and fruit juices throughout the day, and not just when you're feeling thirsty, so your body's temperature can stay regulated. Again, like Shani mentioned, you want to avoid drinking that alcohol, caffeine, and sugary drinks because those can increase dehydration. One of the most important things you can do, especially during a heat event, is make safe contact with those at-risk family members, friends, or neighbors that Shani mentioned. So make sure that they are using air conditioning if they have it, drinking plenty of water throughout the day, avoiding physical activity, wearing lightweight clothing, knowing those signs of heat-related illness, and know when and how to get help. Again, just to reiterate, checking in on your neighbors and family members who are most at risk of heat-related illness can help prevent negative outcomes when temperatures are hot. Okay, and so this next slide is about our heat response actions. The city has a warning system that lets people know when they should be concerned for their health during extreme heat events. And so the first is a heat caution. A heat caution activates public messaging and puts partners on standby who will offer services to people in the city. During this, oftentimes a code red is happening and the city performs 24-hour outreach to people who are unsheltered. People on our community response partner network get messaging, so we hope that you are all signed up for that. The next alert system is our heat health emergency. And this is declared when temperatures are of concern for our health. And so the city will activate Philadelphia Corporation of Aging Heat Line and PDPH mobile teams, the activation of cooling centers with extended hours, and then halt utility shutoffs for residents in non-payment status. And so to be the first to know about when a heat health emergency and other public health hazards are happening, we recommend signing up with OEM to receive up-to-date alerts and text Ready Phila to 888-777 or visit phila.gov/ready. I mentioned that during a heat health emergency, the PCA helpline is activated. That number is 215-765-9040. During a heat health emergency, PCA operates a call center for people to get heat safety tips. Health department nurses can speak with people about medical problems related to heat. One thing we do want to mention is that the heat line does not give out free air conditioners or fans. And so our next section, we're going to go over some of the resources. I think this is what everyone has been waiting for. And so we will first start with our cooling centers. Cooling centers are air-conditioned spaces that stay open late during a heat health emergency. Oftentimes, those are your local library, your rec center, some of the older adult centers. And so you can call 311 to find a cooling center near you. If you can't get to a cooling center, we recommend, again, visiting your local senior center, a shopping mall, go to a friend's house who has air conditioning. Even a short time in air conditioning can help your body recover from heat. Next, we have our public pools. They are a great way to cool off with the family. Last year, 50 pools were open for the summer. The city pools also offer free swimming lessons. And so for more information about city pools and for the pool opening schedule, you can visit phila.gov/PPR. And then the last fun way to stay cool are our spray grounds. You can see a picture of some little girls playing in the spray grounds. They're often all around the city, and they're not just fun for the kids. And so to find a spray ground near you, you can visit bit.ly/spraygroundfinder. This next resource we have is called Artreach. The city has a number of museum and historical sites that are a great way to spend indoors during really hot weather. And so Artreach is a great resource to share with your family and friends. You can visit art-reach.org for locations. They provide $2 admissions with access and EBT cards and free admissions for kids under 18. We recommend you to encourage your neighbors to explore some of these museums and sites on very hot days. And so we've been mentioning the importance of using air conditioning, but we realize that that can increase bills. One of the biggest ways you can prepare for the summer weather is by knowing what to do with utility assistance programs. And so one program we like to highlight is USEF. They provide up to $1,500 to help pay for your energy bills. You can contact USEF at 215-814-6837 or email them at utility@usefacts.org. We also have, we'll share the materials and the resources from this presentation with you all at the end, but we have ways to get more information about these programs. This is just a picture of the flyer that can be sent to you all. This slide is some of the programs that can help pay utility bills. So we encourage you all to look into these programs. We have PHL neighborhood energy centers where you can apply for bill payment assistance and learn how to conserve water, gas, and electricity. Basic systems repair, you get free repairs for electrical, plumbing, heating. I talked about USEF Acts, and then the last one is PICO_help, and get a monthly credit towards your PICO bill and look into any other supports. For everyone in this training, you are getting to know about some resources early, so in case of emergency, you're already prepared for the summer heat that we are expecting this summer. This next slide is about preventing water shutoffs. And so the Water Revenue Bureau and the Philadelphia Water Department offer a number of bill payment agreements for qualifying customers. So we really recommend to visit the website bit.ly/prevent water shutoff to learn more about these assistance programs. The first one I'll mention is Apply for Assistance, which is a 30-day window of protection from water shutoff to any customer who requests an application. The next one is Request a Payment Plan, and you can give a call to the Water Department at 215-685-6300. Next one is Medical Delay. If you are sick and need water service for health reasons, the Water Revenue Bureau may delay the shutoff for your services for 30 days. And then lastly, we have Raise Your Hand, which is a shutoff exemption for seniors who are 65 years and older, a person with a disability or serious illness, and children under the age of 18 living under the roof. Your water will not be shut off. And so we really recommend that you all take advantage of these programs and learn more about them and how they may be able to assist you this summer. All right, and this was just a slide on the neighborhood energy centers that I had mentioned earlier. There are a number of different centers within Philadelphia where you can learn about conserving your energy. So feel free to scan the QR code or visit the bit.ly/PHLNECS to find a neighborhood energy center near you. So 2 years ago, we developed the Extreme Heat Guide in partnership with the Office of Sustainability. And anyone can go to www.phila.gov/heat to read about extreme heat events at any time of the year. This site has information on who's at higher risk of heat-related illness, heat safety tips, a number of different resources and downloadable and printable resources in multiple languages. And so you can, again, visit that www.phila.gov/heat. Whenever there is updates to the phila.gov blogs about heat emergencies, that will be updated on this page. And we're getting to the end. Just wanted to share that all of the information that you learned in this presentation is available in printables and downloadables so you can share with your family and friends or just have on hand for yourself or for your organization. All of these materials that we have been translated in multiple languages and are free to order and can be mailed directly to share with you and your family. And that concludes the end of our presentation. You can feel free to stay connected with us at Public Health Preparedness at phila.gov. Leave us a message if you have any questions at 215-429-3016. Again, we hope you are all signed up for our Community Response Partner Network. That if you aren't, you can sign up at bit.ly/PHL Community Response to stay up to date with health alerts from our program. I will stop to see if there's any questions in the chat. I think they are all being answered. Yes. Well, if you have any questions, feel free to contact us. If you would like educational resources for your family and friends or for your organization, please connect with us again at Public Health Preparedness at phila.gov, or request free resources to be mailed to you at bit.ly/PHP materials. Thank you, and stay cool this summer.